believe that the moment you visit the dentist for any oral health condition, the dentist is going to yank out your teeth. I don't know how they came up with that, but that is not true. It is not true at all. Hello, you're welcome to my channel. In today's video, I'll be debunking some dental myths that has affected people's attitude towards their oral health. We all know what a myth is, something that has been there for a long time, that has been misconstrued to be true, but it's not true. So here we go. The first dental myth is that brushing harder makes your teeth cleaner. I can't even say that enough. If you've seen some of my previous videos, you've heard me say that it is not the force you use in brushing your teeth that keeps it clean. You can use 1,000,000 Newton of force on your teeth, you're only causing damage. If you brush with so much force, you're not necessarily cleaning your teeth, you're causing damage to your teeth because the force of brushing is going to wear out your enamel, right? And if you wear out your enamel, you expose your dentin, which is a sensitive part of your tooth, so you can come down with sensitivity. And also, forcefully brushing your teeth can cause damage to your gum, and it's also not good for your oral health. So please, if you brush with so much force, stop brushing forcefully. The second thing is that the more the quantity of your toothpaste, the cleaner your teeth is going to be. You know, I remember one of the videos I made, the one I talked about what happens when you don't brush before going to bed. Someone wrote me and said, you know, I brush very well in the morning. I fill the bristles of my toothbrush twice to brush. So I don't really think it's necessary for me to brush at night. And I'm like, what? I mean, the toothpaste companies are going to be so happy. It's just like saying I use a whole tablet of soap in having my bath in the morning, so there's no need for me to have my bath at night. But it's not necessarily the quantity of toothpaste that makes your teeth clean. It's more about the efficiency and the technique that you use in brushing your teeth. So you could use an entire tube of toothpaste, right? But if you don't do it well, it's not going to get your teeth clean. And also, brushing twice in a day. So it doesn't matter how much or the quantity of toothpaste you use in brushing in the morning, you still need to brush at night because you've eaten, you've done a number of things with your mouth, so there are organisms in your mouth that you have to get rid of. You also have to get rid of some of the food debris in your mouth that can cause damage. So yes, it's not the quantity of the toothpaste that keeps your teeth clean. It is more of the technique and the efficiency of your toothbrushing. The third thing is that charcoal toothpaste is more effective than regular fluoride toothpaste. Well, there isn't enough study yet to prove that. And what is known is that when you make use of a charcoal toothpaste, it can actually abrade the surface of your teeth, right? Like the whole friction force is going to cause an abrasion of the surface of your teeth. So abrading the surface of your teeth, like you've created like micro grooves where microorganisms can get into, there will be more plaque accumulation and calculus. And also, if you use it for a long period of time, you could also wear out your enamel and expose your dentin and then come down with sensitivity. So for now, there isn't enough study to prove that charcoal toothpaste is better than your normal fluoride toothpaste. The fourth one is that you're supposed to brush immediately after every meal. When I was much younger, I used to also think that that's the best thing to do, brushing immediately after every meal so that you get your clean teeth and all. But I mean, realistically speaking, it might not even be feasible because you're probably a student or you're working, so you don't get to carry your toothbrush around because you want to have a clean teeth. But beyond that, depending on what your diet is, depending on what you eat, it's not also very safe for you to brush immediately after eating, because if you ate something that has a low pH, I've talked about that in one of my videos. If you're eating something that has a low pH, right, it means that your teeth, the enamel, the outer covering of your teeth, is more at risk of being damaged already. The low pH strips it of its strength, its protective strength, right? So if that tooth, you've eaten something that is acidic and then you go on to brush, you're just facilitating the demineralization process. I hope you understand what I'm saying. So you're already eating something and that thing is inherently going to weaken the strength of your teeth. And after you've eaten that thing, you've also gone to bring your toothbrush and then you're brushing. So the whole frictional force there too is going to intensify the whole demineralization process. So even if you must brush after eating, give it some time, right? Give it some time. Allow your salivary flow to normalize, and if possible, just rinse your mouth with water. But make sure you brush at night before going to bed. The fifth thing is that chewing gum is a good substitute for toothbrushing. I don't know who sold that to people, but yes, chewing sugar-free gums that have xylitol, sorbitol rather than normal sugar are okay because the whole chewing process, it's stimulate salivary flow, and as I once mentioned in one of my videos, saliva has some antibacterial effects, and then they also help rinse your mouth of debris. So if you're chewing gum, it can stimulate your salivary flow, help rinse off some food debris, but it cannot be a substitute, right? And it's even worse when you're chewing a sugar containing gum, because we already know that sugar is what these microorganisms feed on. So when you chew them and then you do not brush, eventually sugar gets stuck in your teeth, on your surface of your teeth. The microorganisms feed on them, produce acids that damage your teeth. So no, chewing gum is not a substitute for toothbrushing. Then this particular one is very funny. I mean, many people have that notion, and I still don't know who sold it to them. The notion that the moment you visit a dentist, the dentist is going to yank out your teeth. That's totally not true. Dental extraction, that is removal of your teeth, is usually the last resort, and it could be because of a number of reasons. The first reason being that the health or the condition of your tooth has gone beyond remedy, right? It's at the point where it is irremediable with the technology or the facilities that are available. So if you've been having a dental condition, toothache and any of these things, and you've been trying to manage it on your own conservatively, taking herbal concussions and a number of other things people do rather than coming to the hospital, chances are this is going to keep progressing, and to get to a point where there might not be anything that could be done for it, or even if there is something that could be done for it, it's going to be really, really advanced and very, very expensive. And in most cases, people cannot afford that amount of money, so they just opt for extraction. So let's say you have a hole in your teeth and they're telling you that, oh, this hole has gone beyond where we can just put a filling, right? We need to do an RCT, root canal therapy, which involves cleaning up the inside of your tooth, removing all the microorganisms causing those pain and all. And it costs money, right? And many people who cannot afford that amount of money, they are going to opt for an extraction. So eventually, the dentist is going to do what you can afford, right? Because this is not all the reason why you can get your teeth extracted. But if your dentist recommends an extraction, it's likely going to be the best treatment option available to you. But that is not the only thing the dentist does for his or her patient. So if you're having any oral health challenge, any dental condition, rather than waiting it out and hoping that it's going to take care of itself over time, I would strongly recommend that you visit a dentist, because the earlier you visit a dentist, the better for you. So dentists don't always take out your teeth when you visit them. There are a whole lot of dental myths, and I know I haven't exhausted them in this video. I'll be talking more about them subsequently. And if there are other things that you've heard that you doubt their authenticity, how true they are, you can also leave them in the comment section, and of course I'm going to respond to them. Thank you very much for watching. See you in my next video. And as always, if you found this video helpful, give it a thumbs up, remember to subscribe to my channel and share it with your friends. I love you guys.